I would like to ask your both permission to use this video for educational purpose on the internet. Do I have your permission?
Yes.
Tell me what you just told me.
Well, we did the surgery 9 months ago, and pain was just intolerable. I have a intrathecal pump in my hip, and the medicine from that was not even enough to get my pain down to a tolerable level. And that's when I finally retired 3 years ago, came to you this last year, and said it's time to look at some options on my back.
Yeah.
And you felt your vertebrae rubbing against your hip, which caused
Yeah,
a good deal
it
of
felt
pain.
like one of my vertebrae was rubbing on my hip. The pain was so bad. It was all, my discs were gone. I was bone on bone, multiple nerves being pinched. It was ugly. The scoliosis was bent over 56 degrees at one point. But anyway, when I come to see you, you were the second person I saw. The other person said third.
Yeah.
Didn't feel comfortable doing the surgery. And I really wanted to do the minimally invasive because of my age and that.
Yeah, well, as well, you had some heart problem, right?
Yes, exactly.
Yes. So the other surgeon weren't wrong to say that surgery is risky.
Yes.
But we discussed what the risk versus benefit, what the limitation of what I do is,
Yes.
and you are at the border of what my system, my technique can really anything achieve.
Yes.
And we did the surgery.
Yes.
Yep.
And you just told me something that you don't believe what?
So, I mean, my expectations coming into this was if you could get my pain at least down by 50%, I'd be happy.
Yeah.
Because it was just that bad. And I've had this for 30 years. And as of today, anyway, my pain is down in the lumbar area, is down to almost nothing. It's maybe a 2 out of a scale of up to 10.
Yes.
And I was having some real problems after the surgery with my SI joint. It seemed like that was flaring up real bad.
But then we did the injection, and 80% of that pain was gone, right?
Yeah, the first 5 days, 80% of that pain was gone. And then it kind of wore off, but I'm still 30 to 40% lower than what I was.
And that's a couple months later.
Yep,
Yeah.
yep. So I'm feeling even down there, it's tolerable.
And actually, you're the third surgeon we talked to that would do it. There was a fourth that would not do it, and the other two were talking about.
So 3 surgeons wouldn't do the surgery.
No, 2 would, but they were talking about 2 8-hour surgeries within a week, like basically taking them apart and putting them back together.
Yeah.
again.
And with my heart, that
And
was
with your
too
heart
risky.
situation,
Yeah.
and the cardiologist was saying you have to be started back on the anticoagulation right away.
Yep,
And I don't believe any of our surgeons would, if your heart really need to be started on anticoagulation right away, like same day after the surgery. And it's really a rare situation that we surgeons wanna
Yeah.
commit to a regular surgery
Yeah,
for
and
that.
these
Yeah.
were just consults. They
Yeah.
weren't.
yep,
They
They
didn't
were-
look at your heart situation. They just
Probably not.
yep.
Probably
Well,
not.
we did the surgery, and you just told me you can't believe that your pain is this
I
good.
never thought my pain would be this low. I am just ecstatic.
Yeah.
I'm looking forward to being able to do more things. You've given me hope again. It's like it was getting hard.
Yeah.
I know. Well, your surgery wasn't an easy surgery, and I'm going to turn around, actually show you what we did. And I just want to tell, this picture is not perfect by any means.
No.
This is not what my usual spine surgery looked like.
But that's
But-
way better than what it was.
But,
Yes, it
but the thing is, your back was bending and twisting in so many different
Yeah.
ways that this is the best I could do.
Yeah.
And, we took a risk, literally by, open surgery wasn't an option. Literally with your heart
I
situation.
know.
But this is the best we could, with no understanding that the limitation, but it worked.
It did.
And that's, I think that what I need some of my colleagues, especially some of my colleagues who criticized me, for helping you. Literally, they criticized me for helping you.
Wow.
And that's what I need to know, that the consequence of not helping patient in a borderline situation, difficult situation, maybe it doesn't have consequences for the surgeon, but the patient, imagine you would have been in the same kind of pain you have been in the last 3 years.
For the rest of my life.
And
Yep.
that is the risk that patient have to take, and sometimes we surgeon have to take the risk with the patient.
Yep.
And he makes a difference in so many people's lives. He's like, people love him, so it would be.
I can understand that.
Yeah.
Well, thank you. I really appreciate that. I think every surgeon should as well listen to this, that this decision is not just, one-dimensional.
Yeah.
Okay?
And certain risk should be taken if the patient understands everything,
Yes.
what the risks are. I mean, I made a
This
logical
was no walk in the
decision.
park, for
Yep.
sure.
Yeah.
Yep.
Yeah.
Yeah.
Well, but we
It's-
are there. Bone is growing
Yeah.
beautifully.
Thank you.
We are not done. 9 months out. We have a little more to go.
Yep.
We are not done, but we are going the right direction, and we are going the right direction faster than I thought we would be
Oh,
going.
hallelujah.
Yeah. Okay. Well, thank
Yeah.
you. I appreciate.